and comfort the strong. You're here for the broken. This is my song of intercession, God. Only you know. Only you know how it feels inside. This pain when you try to hide it. Afraid to cry for help. You smile and drown it out. Only you know how it feels inside. To try and try and try and try and try and fail. Only you know why it's 8 o'clock and he's not home. Out with his boys drinking, cause he knows when he goes home and opens that door, it's another night of fighting or silence. Oh, she's cutting up deep, and they just think that she's crazy, but you know better, doc. You know she's being touched in the wrong way. Oh, doctor, can you heal him? I pray, cause if you don't, he will not make it. Doctor, can you heal her? I pray, cause if you don't, she won't make it till the morning. Doctor, can you heal them? I pray, cause if you don't, they will not make it. Doctor, can you heal them? I pray, cause if you don't, they won't see the morning. Oh, 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 oh. Only you know how she feels inside. These feelings she's trying to hide, that's for another girl. It's not supposed to be. Only you know she prayed and prayed. How much she is afraid to get the help she needs. That your blood can set her free. Oh, only you know she's going to church but losing hope. Cause he's tired of repenting for the same things over and over. It's almost over for him. Only you know I'm surrounded by broken people, and they need a hero cause they can't fix what's wrong on the inside. Your boy's here in the city. Doctor, can you heal her? I pray, cause if you don't, she's not gonna make it. Doctor, can you heal him? I pray, yeah. Cause if you don't, come, no. Doctor, can you heal them? I pray, yeah. Cause if you don't, no. Doctor, can you heal them? I pray, cause if you don't, oh, they're not gonna make it. Rafa, promise that you're the healer. Promise that you're the healer. By your stripes we are healed, 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 healer. Jesus, Doctor, can you heal it?
Pleasant good evening to everyone, and I just want to welcome you guys to Heavenly Medicine. It's just a pleasure to be with you once again, guys. I missed you guys so much. It's just a wonderful experience to be back here again today as we have a special guest with us. So today's guest we have is Dr. Nuris Jones, and on Heavenly Medicine today, our main topic will be discussing the benefits of fasting and meditation. Okay, guys, so today it's a wonderful experience as we want to teach our viewers and our listeners about meditation and also fasting today. So again, I'm your host, Dr.Zayniah Louison, as I welcome you to Heavenly Medicine. So guys, I just want to say thank you, all of you that are viewing, all our listeners, all our viewers, whether you're on YouTube, Facebook, or whether you're on the radio station, whether you're on your way at home or you're at home relaxing. Thank you for joining with us. Thank you for tuning in as we are about to begin. So guys, let's relax, sit, and enjoy the show. Okay, so I just want to welcome my beautiful guest. She is my friend, not only my friend, but also my colleague. And I just want to welcome you, Nuris, today. How do you feel being with us?
Thank you. Thank you so much, Zayniah, for having me. It's a pleasure. It's actually a privilege to be here. So I feel really, really happy to be here with you today.
Yes. Okay. All right. So I just want to ask you, can you just tell our viewers and listeners a little bit more about you? So I'm just going to allow you to just feel free to share a little bit about you so our guests, our listeners, and so can know a little bit more.
Yeah, sure. All right. So as you said already, you mentioned my name. So my name is Nuris Jones. And before I actually go into what it is that I do professionally, I just like to consider myself as a person. So I consider myself a daughter. I consider myself a wife. I consider myself a sister, an aunt, a dear friend to many, like you are my dear friend, right? Most of all, I consider myself a child of the Almighty God. All right. So now in terms of what I do professionally, so I am a medical doctor and I've had experience in both academic medicine as well as clinical practice. In my clinical practice, most of my postgrad training was in the areas of obstetrics and gynecology and internal medicine, right? But as of lately, I've been dedicating most of my time to the study and research of intermittent fasting and meditation. Now, one might ask, why am I doing that, right? So my aim here is just basically to combine these areas of study that I've been dedicating my time to with the conventional medicine that we've learned, right? So I want to basically merge them together. So what I'm aiming to do is to give patients or persons, right, a more holistic approach to healthcare so they have more options, all right? So it's like a more complete package. And overall, what I want to do is just basically help persons in terms of like prevention of these, chronic diseases, certain illnesses that we see persons come down with eventually. And if you're already diagnosed with a condition, to prevent the flares or crisis, right, from them reoccurring very often. And, just long-term, probably over long-term, just curing these diseases, healing, and just that general sense of well-being. So that's basically what this is all about.
Wonderful. Well said, Dr. Jones. Okay, so I just want to ask a little bit more. Okay, so as we dive into it all, now, why do you believe there is such a need for a new approach in health care and medicine?
All right. So I'll just give you I'll share a little bit about my personal experience while I was doing my clinical practice. Okay. So what I noticed is that we had patients that we were treating for chronic diseases. Yeah. So in medicine, when we talk about chronic diseases, we're talking about long-term diseases. So usually you hear they say there's no cure. So we had patients, we were treating them, and they, we treat them, they're on their medications and so, but we realize it's like they're not really getting better. Okay. So how we usually would monitor patients, as you would know, right? When we're seeing them in clinic, we would monitor them based on their labs. So the labs is what we call like their test results, or we monitor them based on their readings. So their readings could be like their finger stick, it could be like their blood pressure. So sometimes they would come, the readings would be fine, we'd send them. Sometimes it would be not too fine, so then we'd have to make certain adjustments with their medications, right? Yeah. So sometimes we would adjust, we'd probably add a medication, we'd probably, probably up the dose or something like that, but we make adjustments. So then they'll be fine for a while, then they'll come back again and they're not so fine. So it's like, it sort of felt like a yo-yo. Yes. So it's like, it's neither here nor there, and that is what led me to do some reflection.
Okay.
Right? So then I reflected, and then in the reflection, I was thinking of, what is health? So when we talk about health, what is health, right? So when we look at the WHO definition for what health is, right, it talks about health not just being rid of illness or infirmities, but it also talks about health being your physical well-being, your social well-being, and it also talks about your mental well-being as well. So then while I was reflecting, I said to myself, we were trying to address, the physical, but there was some certain lack in terms of the other areas. So like your social and the mental. And the social, I usually like to combine it with the economical, right? And the reason being, for example, you can tell a patient, okay, let's make dietary changes, because as physicians, we do give counsel, right? In terms of nutrition and so, right? But guess what? We know when we go on a specific diet, sometimes it's expensive, right? Because eating vegetables and fruits and all those good things, right? So if they don't have that finance, so that's why I like to combine the social with the economical. Because if the finance is not there, then it means that they are not able to do it, right? And then the mental, I like to combine it with spiritual as well. And I'll just raise the point that when we're talking about mental health, we are not just talking about the lack, right, of a mental illness, but we're talking about our general mental well-being. And I like to combine it, as I said, with spiritual well-being. All right, so now with the approach now that I'm taking, basically we're going to be addressing those social aspects. And when we talk about the social aspects, we're looking at all lifestyle changes. So we're talking about nutrition, right? We're talking about exercise, because persons would have heard that, okay, you need to eat well, you need to exercise. But now we're also talking about fasting, right? So we're talking about intermittent fasting. So all of that will be lifestyle changes that persons will be making. And then when we're talking about meditation, that is going to address the mental and the spiritual well-being. So basically merging all of them together now, now you see that is it. You have that holistic approach, and that is basically the aim here, to be able to offer that and to be able to look for, better results, better outcomes.
Okay. All right. So I still want to get into a little bit more about it. Okay. So how did you even come across this? Like, what made you believe that as a medical physician, what made you believe that meditation and fasting can add to the holistic approach of an individual? What made you believe? What was some of your convictions?
Right. So there are a lot of research in it, right? So there are a lot of research that's been done and a lot of information out there. And as I go more in depth, I would share about that research, right? But for me personally, it came naturally. So it was something I consider to be like a gift, right? So it's like a gift. I consider it to also be like my calling. So it's something that came naturally. So it's basically a big part of my life. It's intertwined with what I do every day. It came naturally for me. So if I have to share with you now how I started fasting. So before I even knew about what fasting was, I actually, so when I was back in secondary school, so I would have been about 14 years old. And during my lunchtime, right, or break time, I just used to skip lunch, but I would read the Bible.
Wow.
Right? So I skipped lunch and I read the Bible. And I felt filled on the Word of God.
Wow.
And I just didn't feel hungry.
That's kind of unique for young people, because not many young people would take a break and decide that they will go and not have lunch and go read the Bible. So that was pretty impressive.
Right. And that's why when I reflect on it, I say, you know what, that was actually my calling.
Okay.
Right. And before you knew it, I just continued doing it into my adulthood. And then eventually when there was more information on it, then I read up on it and, and then I said to myself, but hey, I've been doing that all this time, So that is how I came about fasting. For the meditation, it was introduced to me a little later on. So at this time now, I was about 17 years. I was in college, and my dad brought home a book, and the book was called The Power of the Subconscious Mind. So I had never heard of the subconscious mind. So of course you're interested. You read the book. So basically the essence of the book is just talking about your thoughts, right? So it talked about how powerful your thoughts is. So you feed the mind on positive things, you get positive outcomes. You feed your your mind on negative stuff,
Yes.
negative outcomes, right?
Okay.
So what I did now, I just basically incorporated the principles of this book into like my morning devotion. So it's
Okay.
like when I'm doing my devotions, I would affirm. So
Yes.
you would affirmations is just basically a declaration. So you're going to
Right.
declare
Yes.
that, you know, healing, and you
That's
just
correct.
basically incorporate it with that daily devotions.
Okay.
And at that point, I actually was having a lot of headaches, because you know it's not uncommon for young persons. You're in college, you have headaches, you
lot
have
of
anxiety,
studying,
a lot of
anxiety,
study.
a lot of
So it probably could
exams.
have even been all of that. I'm not
Right.
even sure, right?
Okay.
But all I knew before I knew it, like I got like this sense of relaxation.
Okay.
And before you knew it, the headaches were gone. I didn't even know when they went, but they were gone.
Okay.
You know?
So when you say affirmations, are you saying that using the word of God as you were meditating, you would use the scriptures maybe to say, I am beautifully and wonderfully made.
Of course.
You know, by his stripes I am healed.
Of
I am no
course.
longer a slave to fear.
That is
Greater is he that lives
yes.
in me. You
and
know?
the Bible has a lot
Many,
of them. So
that's
these are
right.
what they call, when you hear affirmation,
That's
it's
correct.
basically that declaration. You
Making,
you
decreeing and
proclaim, you
declaring
speak
positive
it
things,
into
life
being.
into being.
That is it.
Because
That's
the
what,
word of God does say that life and
Yes.
death lies in the power of the
The
tongue,
tongue.
and he that loves it shall eat the fruits of it.
You're
So
correct.
It is something. It's something
You're
we have
correct.
to do.
We have to do. We
yes,
have to. Yes.
wonderful.
So that is
okay.
what. Yeah.
And you did get results.
I got results.
That's
And
good.
it has just been a part of my journey ever since. So right now I cannot see myself without either, and I've basically merged the both of them together.
Okay.
So meditation for me and fasting, they both go hand in hand. And the reason why I say that is because during your meditation, for you to be able to achieve that highest level of spirituality and to connect with your creator, you have to deny the flesh. And what's the best way to deny the flesh than to go on a fast?
I want to just ask
Yeah?
a little thing, as you mentioned, you know, because at the end of the day, we are physicians, we work together,
Right.
we, you know, and we know sometimes how hard the workload can be, right? And what has happened over the years, we have noticed that a lot of physicians themselves had denied themselves, denied their health, you know, and it's sad because a lot of the public are not aware, you know, they may look at a doctor and say, oh, you know, they're good, or they have everything going good for them, or not really understand that this is an individual, a human, they have a life, they have family, they have, you know, they have bills, they have, you know, certain challenges as well. And many, as we can see, many of us, as I would say us, there were many times where we have neglected our own health, our own, you know, in terms where we could have done better. You know, I would just want to ask, how is it were you able to manage, especially working in such a you know, fast-paced environment when you were on internal medicine or even gynecology? Like, how was it that you were able to manage or cope, or what can you advise even our colleagues as well as to
Right.
how to, with the same meditation and fasting, is there anything you would like to share?
So yes, so I would say it's actually the both of
Okay,
them that has
okay.
kept me grounded, because
Okay.
it comes back to sometimes, you know, like now that we're not working and we're like doing calls, now that we're not working at the hospital
Calls are
in that
tough,
setting and doing
yes.
calls.
Yes, calls are tough.
Sometimes I say to myself, but hey, how did I survive
Yeah.
these calls? And I really think it really came back to the
think
both
it's
of
only
them.
God.
Yes, you know, of course with Almighty God as well.
Thank you,
You know, because
Jesus.
like there's no other way. There's no other way to explain it, Zayniah. There's no other way.
Okay, wonderful. Okay, so as we move from that, then can you just explain a little bit to us now about fasting? So what we can see, like, can we give our viewers a definition? You know, many people have different ideas about fasting. You know, some people would say, oh my God, I don't think I can even hold maybe an hour without food. You know, I'd like us to share a little bit more about fasting today, you know,
Yes.
and may our viewers and listeners get a better idea about fasting. Some may know, but let's see how best we can make it, simplify it for them
Okay.
today.
Okay, sure. I
Okay.
like the way when you said they can't go without, because I know I get that a lot. Sometimes
Yes.
when you say fast, and we're going to debunk some of those myths at the
Awesome.
end, right? Because
Okay.
there are a lot of stuff that's keeping us back, right? From
Okay.
beginning that fasting journey.
Okay, wonderful.
So if we had to look at the definition, okay, so when we talk about fasting, what is fasting? So when we talk about fasting, we're talking about the willful refraining from eating, and sometimes drinking.
I
All
like the
right?
word willful.
Willful.
So meaning if I don't want to, that already messes with my mentality. So I'm already, if I'm not willful, it's something that your mindset should be already prepared to do. So if I haven't done it, if I'm not willful, it's obviously chances are I'm going to fail.
All right.
Right?
Right. So you have to will. There have to be some will
Will.
to do it.
Yeah.
Right. So you're correct with that.
Yeah.
Right. And I like to point out that sometimes when we fast, we can be drinking.
Right.
Right. So we can
Okay.
have certain beverages in the fast, but you're not going to be eating. So
Okay.
that's the important thing here. You're not going to be eating.
So it's actually preventing the flesh or the body from food.
yes.
Okay.
You're
All right.
correct.
From the pleasure of
Yes,
food.
you're
Okay.
correct. You're
Okay.
correct. All right. So one of the things that I like to say to persons, right? Fasting is not something new. So nothing that I'm saying here is new. As old as humanity or mankind is, fasting has been there with us.
Yes.
Fasting is something that is embedded in religions, right? If not all, but most religions, fasting is embedded. And I mean, you know, right?
Yes,
Even
yes.
biblically,
Correct.
there are a lot of examples
Many,
where
definitely.
people went on a fast.
That's
all
right. We
right?
had Esther when she had to fast. They had to call a fast, right? And I mean, I'm not going to go into it all,
Yes.
but I know for sure we had the fast where Esther called the fast. We also have the fast with the Daniel fast. And I know the Daniel fast is a very, it's common among many churches in terms of, I know some churches, well, I myself would have done it January. I think it starts at January.
Okay.
And I think we end, I think it's for 21 days. Yeah, I think the fasting goes, I think there's a fasting, it's 21 days.
Okay.
Most, I know a lot of ministries do practice the Daniel fast, and there's the other different fasts as well that has been in the Bible, where David fasted, right? And so I know a lot of us are we are aware of fasting.
Yes, right. Yes. So it's just to remind us that it's nothing new, right? It's a
Okay.
part of who we all are, right?
Okay,
We can
alright.
fast,
Okay.
right?
Yes, we
and
could
as you
fast.
said earlier,
Yeah.
once you have the will, that's the
Yes,
important thing. You have the will, you can do it.
Yeah.
Okay?
Okay.
All right. Right.
Okay.
So if I had to go talk a little bit more now in terms of the different types of fasting.
Yeah.
All right. So we have what you call a juice fast, right?
Okay.
So you could do a juice fast. So we could talk about them in terms of what you're taking in.
Yes.
So the juice fast is one of those, like in terms of if you're now starting out fasting,
Yeah.
right? It'll be one of the good options to start with because you still get a little bit of caloric intake, right? Even though you're not eating, you still get caloric intake. And when we talk about juice fast, we're not talking about box juice and those sort of things, right? We're
Okay,
talking
good
about,
to know.
we're
Good to know, guys.
We're talking
Okay,
about
you
your
heard the
local,
doctor.
your local juices.
All right. So it's
Okay?
fresh juice from the
Fresh
fruit.
juice
Are
that
we
you
adding any
made.
type of sugar to
No
it?
added
Okay.
sugars, no refined sugars,
All
right?
right.
Because those will not be good for your body, right?
That's
Because
right.
remember, we want to cleanse the body.
Okay.
Right? So we want, sometimes you could juice vegetables. It doesn't always have to be fruits.
Right.
But whatever you choose, that's what we talk about.
And we
the
could
juice
blend
fast.
it.
You could blend it up, make it in a
Okay.
smoothie.
All
right?
right.
Whatever works
And it's getting
for
really
you.
popular now,
Right.
smoothies
Yes.
and yeah.
So that's
All
your
right.
juice fast, right?
Okay.
One could choose to go on a water fast.
Okay.
All right. So the water fast, as it suggests now, you're going to be drinking water. So you're
Yeah.
drinking water at certain intervals during the fast, right? That's a water fast. Now, if you're not going to be eating or you're not going to be drinking at all, then we call that a dry fast.
All
So
right.
no, nothing. You know how
Yeah.
we say nil, right?
Yes.
Nothing, NPO, nothing
Yes.
goes in.
Yes.
Nothing by mouth, right?
Nothing
So,
by mouth.
Yes. So
Okay.
nothing goes in by mouth. And that's a dry fast. Now, it have other classifications for the dry fast, but I think for the show today, we don't need to go too much
Okay.
into that, right?
All
So
right
the
then.
dry fast would be
Guys,
no-
I guess we'll get more at her consultation.
all right, all right. Yes. Okay. So that's a dry fast, right? But we could also talk about fasting and classify it as well based on the duration of the fast.
Okay.
Okay. So
Okay.
based on the duration of the fast, we could talk about intermittent fasting. And I think intermittent fasting is something that is trending.
Yes,
I think
it is
a
trending
lot
now.
of persons have
Oh,
heard
yeah.
about intermittent
Yeah,
fasting.
that is
right?
true. Yeah.
We could also talk about extended fasting
Okay.
as well. So when we're talking about intermittent fasting, we are talking about fasting within a 24-hour period. So within that 24-hour period, you have a period of fast, and you have a period of eating. So you have what you call a window period. And I will go into the different ways you can, the formulas for it. Right? But it means that the day wouldn't pass. So today wouldn't pass and Zayniah, you didn't eat.
All right then.
You understand what I'm saying, right?
Thank
So
God for
intermittent.
that.
So you're going to eat at some point today, but you're going to fast. You're going to fast at some point as well. You get me? But if we're talking about an extended fast now, this is a fasting of 24 hours and beyond. So today now, if you're doing an extended fast, it means you're not eating, right? So you wake up tomorrow, you still didn't eat, right? But those are more for persons who have more experience. So some persons would go on a 3-day fast. Some people may go on a week fast, 21. There's a lot of days they could go, but that is based on your experience. So if you're going to start off though, you want to start off slow, right? You want to start off slow and gradually build
Wonderful.
up. Yes.
So what would be some of the benefits though of fasting? What can we say, how can fasting benefit me? What is fasting doing for me?
All right. So there are a lot of research in fasting, right? There are a lot of research in terms of the benefits in terms of our body, right? So we have like one of the physicians who is well-renowned, Dr. Jason Fung. He's Canadian-based too, right? But he has done a lot of research in terms of fasting, and he's treated his patients, so type 2 diabetics, right? And he's treated them with intermittent fasting, and he's actually reversed the intermittent intermittent fasting. And if anyone wants to know more about what he's doing, you can always check out his YouTube channel. He's written books as well, so such as the obesity code, the diabetes code, the guide to intermittent fasting. He's written all of those. So there's a lot, right? So I'll just go into a few of them. All right, a few of them. So of course, if we're fasting, right, it means that we're not taking in calories.
Right.
So what does that mean, right? We're going to have anyone can guess, we'd have weight loss.
Okay.
Right? We're going to definitely have weight loss, right?
Bad.
So it's actually a way to address weight loss.
Okay.
And the thing with intermittent fasting is that because when you're eating now, you don't have to restrict like the food that you eat, food meaning not the quantity per se, but in terms of what it is that you eat, the content, it tends to be something more sustainable. So you know how sometimes we would go on a diet, probably let's say a vegan diet, you'd have all different diets people may go on.
Ketone diet.
But ketone diet, right. But then since you're restricting stuff, you may end up having relapse because you may end up craving stuff. So with the intermittent fasting, you can still maintain what we call like a flexitarian diet. So you eat a little bit of everything, but in moderation. And it has shown to have like it's been more sustainable.
I like that word, flexitarian.
Yes.
I love that.
It's also trending.
Flexitarian.
Yes. So it tends to be a more sustainable weight loss, right?
Okay.
Other benefits of intermittent fasting is reduction in inflammation, right? So when we're eating, so when we're in a fed state, our body uses glucose as the source of energy.
That's correct.
All right? But now when we're fasting, our body switches to ketones.
Yes.
All right? So
before you go, how do we get to ketones?
Right.
How do we get to ketones? So the body now, there's no glucose. So what does the body use instead? So we have no energy because we use the glucose as a form of energy.
Right. So your body is like breaking down, burning fats.
Okay.
Right. So you call it like a fat burning mode. So your body is burning fat.
All right.
And you're getting ketones.
That's right.
Yes.
Okay. Good.
Right.
Okay.
So that's how you get to the ketone.
That's right.
And what studies have shown is that ketones now, the use of ketones actually tend to be less inflammatory on the body. So one of the organs that it has shown to have less inflammation is the brain. So persons who's experiencing fasting, what they would tell you is that during the period of fast, they have higher levels of concentration. They have less brain fog.
Oh, wow.
So it's like that clarity, you know, and of course it's less inflammatory in other organs, but the brain is one of the examples that actually comes up a lot.
Wow.
Yeah. So
I want
these are some
add.
Yes.
I just want to add something you just mentioned, right? And we know that we are, as I'll say, Afro-Caribbean people. One of the things that we have been suffering the most, and I would say not just Afro Caribbean people, but just African people, descent on a whole, you find that type 2 diabetes is a common, it's a plague. I would call it a plague. And even among our people today, even in Grenada, type 2 diabetes is something that a lot of persons find themselves suffering from. It's a chronic disease. Now, in a case of someone that is suffering from type 2 diabetes, would that person be able to undergo any type of fasting?
Very good question, right? Very good question. And again, so just to answer it from that scientific point of view, first of all, right?
Yeah.
So there's a lot of research,
Okay,
right? So that has shown that type 2 diabetes through intermittent fasting, it can actually reverse.
Right.
All right?
Right.
Now,
Because I knew you mentioned inflammation
yes,
and ketones
Because
or less.
type 2 diabetes, the driving point here is actually insulin resistance.
Okay,
Right?
that's
So
correct.
based on what, so for example, when we're eating, so when we're in a fed state,
Yes.
we produce insulin, right?
That's
because we
right.
want to lower the blood sugar,
That's
right? It's
right.
like doctor talking to doctor,
That's
but I
right.
know,
Yes,
I know
we're
you know what
talking
I'm
to our
saying,
viewers,
right? But
yes.
we're talking to our viewers for them
Yes,
to
and our
understand,
listeners,
right?
yes.
So you're producing insulin, but the insulin resistance, right, has actually been shown to be caused by that insulin. So let's say if you're
Yeah.
constantly eating, you're not resting the body, and
Yeah.
you're eating based on how
Yeah.
we've learned
We need a
to
snack.
eat traditionally, yeah? So it's like you're constantly spiking your insulin levels
Yes.
whole day.
Okay.
So the insulin, that is what actually drives the insulin resistance.
That's right.
You get me? And that is what the type 2 diabetes is based on.
That's
we know that
right.
is what it's based
That's right,
on.
because it's not the fact that it's not our pancreas, which is the organ that would secrete the insulin, is depleted of insulin. It's the fact that it will produce the insulin, but it's the
Right.
fact that the insulin it produces is no longer sensitive
It's not
to its
sensitive,
receptors.
so it's
Yeah.
resistant,
Yeah.
right? So that's what we mean by resistant. So thank you for breaking that down.
Yes.
So now think
Yes.
about when you're fasting, all right? So when you're fasting, what happens? You're not eating, right? We said that we're not eating. So then you're not producing insulin. So guess what? Then you help with the insulin resistance. And that
Okay.
is basically how the type 2 diabetes have been reversed. Now, if someone is diabetic, of course, I'm not going to just tell you to go and do a fast just like that.
Yes.
All right? Of
Yes.
course, first of all, you have to consult with your physician.
That's
All
right.
right? We have to see where your finger sticks are at,
That's
because we
true.
need to have a baseline. We need
That's
to know what
correct.
we're starting with, what medications and so you're
That's
on.
correct.
Right? Probably one of the best things for them to do probably maybe a juice fast, but they would have to probably skip in one meal a day, but at the
Yes.
same time, or a snack a day, because
Yes.
usually diabetics tend to have like 6 meals, 6 small meals,
Yes.
right?
Because
so probably
that's what it was,
that's
it's
what it's
told.
been told. So probably
especially those that are on
probably
insulin.
one of the snacks can be skipped, but guess what? You'd have to be checking the finger stick probably even hourly. So I would say in the beginning, in the initial state, that diabetic patient will have to be monitored like in a clinical setting,
That's
where you have
correct.
your physician or your nurse who is able to monitor you, or someone who is qualified, and they're able to monitor you properly. And then it's a gradual, right? Because with those patients who have been in the trials, it didn't come down just like in one day, right?
That's
So what
right.
happened is that their finger sticks went, or their blood sugar reading, it went down, and then some medications were able to be removed gradually, right, until they were weaned off it. You get me? Yes.
So because what I've noticed is that it's quite easier for someone that is on maybe an oral hypoglycemic medication, right, than
Right.
compared to someone that is on insulin.
Insulin, right.
Insulin might be a little bit more challenging as pertaining to fasting, because in a case of you're still at a more earlier stage of the disease when you're on an oral hypoglycemic. So
Right.
maybe, let's say you can check your fasting blood sugar in the morning, you know what it's like. So maybe then you can, if you're cutting, you start slowly. Then
Slowly,
with
that is
maybe,
it.
Let's use fruits and vegetables and having a
Yes.
high carbohydrate filled diet.
That is it.
So fasting as pertaining to a diabetic should be a little bit more in terms of we're changing the types of food we eat slowly but surely, and then
And I like the fact that
know?
you're talking about the type of foods, because remember, although we're promoting fasting, even at the point now when we're refeeding ourselves, it's important to also eat nourishing foods, right? Because you can't tell me you do a whole fast, which is so beneficial. Remember, we're talking about all the benefits it has on the body, and then you go and you break your fast with, let's say, probably something like fried chicken, something that is not going to be good for your body, right?
In
So
breaking the
when you're
fast.
breaking the fast as well, right, and even in the the point, right, where you're refeeding, you want to ensure that you're using nourishing foods. You're eating stuff that's nourishing. So that what you're saying is really good.
Doctor, I just noticed that one of our viewers, they also mentioned some of the patriots and prophets, they also fasted, and even Jesus fasted for 40 days. So, you know, it is
Lovely.
something that is not common. We know, you know, and that means, I mean, many have done it, so we could at least try to incorporate it
Yes,
into our lifestyle.
most
you know?
definitely,
Yeah, I
most
think
definitely.
it's something, it's a challenge, and I think it's something that we can do and try really to see the impact. You know, I've heard other people mention about and different readings that I have in different little research, and it's actually trending. It's the probiotics as well. You know,
Yes.
and knowing about the probiotics and allowing the probiotics in our gut
GI,
flora, which is
yes.
our
The
GI,
tract, yes, or
GI
digestive
system,
tract,
the
yeah.
digestive system, to allow that normal flora to work. So they're saying even when we're fasting, these normal flora, it also recuperates too, because now there's no food in the GI, in the digestive system.
Okay.
So what happens is that the normal flora as well, they work. They have to be working as well with the acid in the stomach to work on breaking down those foods.
Right.
But when now there's no food and it gives it a chance to recuperate, we also rebuild and replenish our normal flora, right? That biota. Right?
Right.
And that helps also bring back the normal flora to the gut, and it also helps with reabsorption of nutrients and actually what the body needs, instead of just flushing it all out of the system. You know,
Right.
so as well, it's the fasting time that will help with all of that, which would improve our digestion.
You're
as well.
correct, and you cure a lot of stuff from the gut.
Yeah.
So all the
Yeah.
acid reflux, the
Yeah.
GERD. Some persons talk about a lot of bloating and
Yes.
gas. All of that you
Yes.
cure it one time.
Yes.
Yeah. So yes.
Yes. Okay. So again, so I don't want to break your flow. We were talking about the intermittent fasting. So I guess we'll just get back to the intermittent fasting and how best, like we talked about the weight loss, right? That is beneficial to us. We talk about also how does it help somewhat in replenishing the body? Is that period when we do that intermittent fasting, what are the benefits when we don't eat? What happens to the body in terms of
Very
the cells
good.
and
Yes.
yeah, what
Yes. So
happens?
you have that replenishing, right? So one of the things we talk about, one of the benefits is called like increased cellular recycling. So
Okay.
the big term for it is called autophagy. So autophagy is just like auto and phagy. So it's just like self-eating.
Yes.
All right. So at some point the
Phage.
body, yes, the body starts breaking down proteins. So like all those mismatch
Okay.
proteins, it breaks down cells that are damaged.
So cancerous cells or cells that are okay.
Yes, it's been shown to have effects on like, so fasting, if you're doing like intermittent fasting, to have effects on like in terms of Alzheimer's disease, so like not for it to come on right away, so
Okay.
basically
It
prevents,
slows down
down,
okay.
right? So slows down
progression as
Alzheimer's, the
well.
progression
Okay.
of it, slow down the progression of certain autoimmune disease, right?
Okay.
Because the body is literally healing itself, right?
Wow.
When we allow it to go into that that phase. Think of something that
Yeah.
it's always in its comfort zone.
That's
So you're
right.
feeding it, it's always in its comfort zone. Will it be efficient? It's
No,
not
because
really
it's
going
like
to,
a car.
it's
If
just
it's a car and it's running,
it's
running,
sitting
running,
and
running.
it's running and
Yeah.
but now when you fast now, the body sorts of going to a sort of shock, right? So it's now going to start getting efficient and it starts going to,
It's in
clean
healing
up,
mode.
heal, and that is
So
basically
can it be used also as a form of detox?
detoxing as well, because
Okay.
all of that is part of the detoxing process as well.
Okay.
Yes.
Wonderful.
definitely.
Wonderful.
Immune booster, detox, everything. Yes.
Okay, great. Okay, so we looked at the intermittent fasting. I just want to use an example, okay? Ways that we can go about this intermittent fasting. Like, can we say 3 hours, 4 hours?
Okay.
Yeah.
So one of the easier ways, right, is actually, so let's say probably skipping lunch, right? That's probably one of the easier ways, right? So you wake up, you have your breakfast,
Yeah.
and you skip lunch,
Okay.
and then you have your supper.
Okay.
So the point when you're skipping lunch, now remember we said fasting doesn't always have to mean that you're not taking in liquid. So if you're
Right.
starting
Yeah.
and you're skipping lunch, you could actually have a drink. So you can do
Okay.
that same, those juices, those
Yes,
healthy juices we
yes.
talked about. As time go on, you could do some water
Okay.
until you could do a dry fast for
Okay,
lunchtime.
all right.
Right? So that's one of the easier ones. Some persons may, if they're not a breakfast person, because some people might say, I'm not a breakfast person, I get up and I can go out to work, probably just have some tea,
Yes.
but they could function. So then
Yeah.
you could have your first meal at lunchtime.
Yeah.
All right? So there are different ways in going on.
And how is the time span, like in terms of the hours and so?
Right. So, for example, let's use an example. So let's say for someone who goes to bed, or not goes to bed, but let's say their last meal is, let's say, 8 p.m. in the night. So by the time they wake up on the mornings, right? So let's say you wake up at 6 in the morning, you're already fasting for how long? 10 hours.
Okay.
I know a lot of persons, when I break it down like that to them, a lot of persons, we're not mindful that while we're sleeping, we're fasting,
that
right?
is
So
true.
we're fasting because
Yeah.
one might say, how do I go on a 16-hour fast?
Yes.
But by the time you wake up on a morning, you're already fasting for 10 hours.
Okay.
If you push that to 8 a.m., right? So your last meal was at 8 p.m. and you push it to 8 a.m., you're fasting for 12 hours.
Okay.
Push it to 10 a.m. That's how long? 14 hours. And if you push it to, let's
If
say,
your last meal was
midday,
at
if you're 8 in the
PM.
night.
Okay,
So
then.
if you're doing like your first meal at midday, but your last meal was, let's say, at 8 in the night, then you're fasting for how long? That's like 16 hours. So you have different
Right.
formulas where one might say they're doing a 16-8. So they talk about the 16 would be like, for example, the period of which you're fasting, and then the 8 hours would be your window period where you can eat, right? So you're
Right.
eating between, let's say, 12 p.m. to 8 p.m. in the night.
Okay.
All right. So it means that, for example, you can have lunch and you can have supper, and by
Okay.
8 p.m. you're fasting again.
Okay.
Right.
All
So
right.
there are different ways. In terms of
Okay.
the formulas for
Okay.
them.
All right.
Yeah.
And what about the extended fasting? How can a person go through extended? Because we know that the intermittent fasting is trending.
Yes.
We're hearing everybody. We have colleagues now that's talking about the intermittent fasting.
Right.
What is the extended fasting and how does it benefit
Right.
us as doctors, as healthcare professionals, also our patients as well? How does it
So for the
benefit
extended
us?
fasting, so that's the fasting where you're going to be fasting for over 24 hours and beyond. All right. So it may be a day, it could be a day, it could be a 2-day, 3-day, but it all depends. I would say if you're going to go into an extended fast, gradually build up, right? So probably start with intermittent fasting, and then
Yeah.
you gradually go on to a day 2 or 3. And it has basically the same benefits of intermittent
Okay.
fasting, and probably even more,
Okay.
right? Because as you go longer in the fasting period, you have different, different things happening in the body, right? So you probably would even benefit more in terms of that cell recycling that we were
Yes.
talking about, the body cleaning up itself.
That's
As you go
right.
on an extended fast, you probably even get more advantage of certain things. But
Okay.
I would say keep it simple before you go into that whole extended
Okay. And then how do
fasting.
we incorporate now? How do we incorporate meditation now into the fasting? How do we
Right.
incorporate all of that? I want to know, how do we incorporate, what I am, any patient comes to you and for consultation, how do we get that? What are the benefits about meditation? Now, before we even go into meditation, first of all, I would like you to, there's many myths and there's many taboos about meditation, right? Now, as I said, as a physician, I understand in terms of what meditation is, and also, as I always say, as a child of the Lord, I do understand that meditation is something that we have to do. All right, as the Bible even say, you have to we meditate on the Word of God day and night, and it's to ponder, and it's to reflect, and it's to definitely bring it in, take it in. When we talk about meditation, it's spending time drawing information, right? Getting counsel, knowledge, and understanding through the Word of God, right? So I personally believe that there are myths out there, right, whereby, the thought of meditation, they think it's some other power or some other, or some other, entity beyond something supernatural, right?
Yes,
Something
yes.
supernatural. And,
Yes.
it's a myth that I really would like, our viewers and listeners to understand that meditation was there with Christians long before, and yes, there are other religions that are now practicing different things, right? They also would be meditating as well, but as believers, the word meditate, it's what we meditate on.
That's right.
It's what we meditate on.
That's right.
Right?
Yeah.
So just tell us a little bit more as to what do you do when you mention meditation, and how does meditation help patients with different conditions?
All right. So I think it warrants, so everything that you said is very valid, all right? And I think it warrants probably me talking about it, mentioning the definition of it, right? So I'll gradually build up into what is it that we do. All right, so when we talk about meditation, so if I had to paraphrase this definition I have here, meditation is focusing attention in a non-judgmental way and in an attempt to not dwell on wandering thoughts. All right, so basically focusing attention. So as you said, that attention could be focused on the word, right? The word of God. All right, so it's literally having an experience with something. All right, so it could be different things, right? And as I go on, you would see what I'm talking about. Then we talk also about mindfulness meditation. So that mindfulness meditation now is just basically your awareness. All right, being present in the moment. So we're talking about focusing attention, being aware, being present. And it's very relevant in today's time because you realize we're always busy. The hustle, the bustle. We go to work, sometimes we bring home work, we're juggling family, friends with the work, and it's just always going. And it's like, when does it slow down? All right, so it's like we just find ourselves going through the motion. We're going through the motion, but we are not actually living the experience. And don't talk about all the devices.
I like that,
and so the experience. And we have added devices. So
some
we
people are addicts to their
we
phones.
on the phones, we on the
some people are
so
addicts
we just
to
have
that phone.
all these things on top of it. So meditation now, this mindfulness meditation is just basically getting you to go at a slower pace and just being aware and live the experience, what it is that you're actually going through. And there are times I know you can't actually slow it down completely. So it has different ways in which you can actually meditate, do those some of those practices that we have to offer, so that it could be beneficial for you based on what is it that you're you're looking for. Yes.
Okay. So tell me, so in a case of an individual suffering with anxiety, what type of meditation or so would you advise that patient?
Lovely. So before I go into either of these, I want to mention that prayer is actually a form of meditation. And you were just saying it, right?
Yeah.
You're just saying it because it's probably the oldest form of meditation that we know. We all, we've grown up, with prayers and so. And there's one thing about praying, though, that actually brings a calm. Right? So when you actually pray and you get into the spirit, and so you actually get very calm. So I think prayers would definitely, it would definitely work, right? For some anxiety, right? But of course, there are other forms, right? So we have breathing meditation. So as the word suggests, breathing. So you're going to be, the focus point here is going to be your breath. All right, the focus is going to be the breath. Now, I don't know if you've ever had a situation where, you either had some pain or something was going on with you. You felt anxious or something, and they say, take a deep breath. Take a deep breath, and you start to take these deep breaths. So this is just basically breathing exercise. And you took these deep breaths, and you felt, didn't you feel better?
Oh, yeah.
You
and
felt
I
better,
remember
right?
as a little child,
so we all had that.
That's right,
So
and we tell
breathing-
patients that often.
Right. Breathing is very, very good for anxiety. Very,
so
very
breathing
good for
exercises.
very good for So then there's another one. This one I really like. This one is called loving kindness meditation.
I like the song of
Loving
that.
and kindness. It's
All right.
exactly what it says, right? Love and kindness. So it's just basically sending off these positive. So this one, you can also incorporate it in your morning devotion. So you're sending off these positive vibrations. You could start with yourself and then you send it to someone. So let me give you some of the things you can say. For example, so you can say, may I be happy. May I be well. May I be safe. May I be peaceful and at ease.
Wow.
And then I could send it to you, who's my friend, right? So I can say, may Zayniah be happy.
Wow.
May Zayniah be
Give
well.
me some of that.
May Zayniah be safe. May Zayniah be peaceful.
Amen.
And
Amen.
at
I
ease.
receive it, my sister, in
But
Jesus'
guess what?
name.
It doesn't end there. You could also send it to a problematic person, someone that may be having difficulty. You might be having difficulty, you might be on a workplace, family, different places.
Situations,
Some
whatever it might
situation
be.
you may have. And do you know the feedback I got from persons who did the loving kindness, but they
I love
sent
the
it to a
loving
problematic person, they told me it felt like a burden being lifted off. Because the thing is that when you're doing those loving kindness and you're sending those vibrations, you're doing it with no strings attached. So it's just like you letting go and you're releasing, but it's not like to say you want anything in return.
That's correct.
And that actually got me to ponder on when the Bible talked about forgiveness.
Yes,
Because when the Bible
come
talks
on
about
now.
forgiveness, it's not for the person who did us wrong. It's actually for us and for our healing. Do you understand? Right? So then with all of that, you get rid of all those anxiety, all the stress,
negative
you know,
thoughts.
all the negativity. And so that is actually, you know, one of the good ones.
I love that one.
Yes.
I love that one. And right here I can see one of our viewers. They're actually mentioning that in the Bible exalts us to meditate. In fact, the word selah, right, in the Psalms means to pause and meditate, you know, and I would love for our viewers and our listeners to know that, because this is something that many people may not know, that the word selah actually means to pause and meditate, right? So I believe sometimes as Christian believers, we may not know this, or we may miss that, right? And the fear of the word meditation, you know, it's like, whoa, that sounds a little bit, you know, off. I don't want to get into that, you know, that actually, especially as the psalmist David, most of the time you read those psalms, you would see selah, right? You would see it in scripture, right? So it's really nice. I think he said, but for far too many Christians, it's seen as a word that's based in mysticism or spooky stuff, and that is very true. That is so very true, you know. So I'm so happy today that you can enlighten us, you know, and that we can put aside some of that taboos and some of those myths, you know, as pertaining to meditation, because we are encouraged to meditate on the word of God. And as you mentioned earlier with the affirmations, if we use the word of God as affirmations and we speak it and declare it, definitely that also brings a positive spirit as well within us, and we carry the positivity through the word of God. We definitely can see actual results coming from that. So I'm really happy that you brought all of those things you know, to light today. I'm really happy that you did that, you know, and has seen results with persons and patients that you have consulted and so on. I'm really happy that you know, you actually have seen the benefits
most definitely
from that.
Most definitely. And you had asked me earlier about like some of the benefits, right, of meditation, right? So because of all that relaxation and so that we're talking about, persons who would have had anxiety, right, so they end up having like less anxiety, feeling less anxious, less stress, in terms of their cognitive levels, so in terms of their better able to concentrate and be focused. There was also improved sleep. So this is like in terms of research now, right? Patients or persons, they experience better sleep. In terms of even persons that had issues with their blood pressure, because now remember we're more relaxed, right? So even blood pressure, heart rate, those went down as well. Even there was alleviation of pain. So they had patients in the trials that had like chronic illness, chronic pain, right? And at least 57% of them, they actually had a reduction. And guess what? Those who were actually more experienced meditators, they had like 90% reduction in their chronic pain. So there are definitely a lot of benefits. And persons who practice meditation, a lot of the times they say they feel like this inner peace, they feel more energetic, more excitement. It's just like you're just in a better place, you know?
So how do a person really meditate? Do we go into a quiet room? I mean, the Bible does say go into your closet and prayer. So I'm just using that as my guide, right? So, you know, so we go into a quiet place or an area, some environment that is somewhat peaceful, right? Not where you could hear all the bustle, but any little part within our home or even the park, right? So we can actually go to a place where the environment is peaceful, but where there's no type of disturbance, right? And we can spend some time, because I want our viewers and listeners, you know, for you to tell us a little bit, how do we, how can we do this?
So in terms of how to do it, there's no right? There's
Okay.
no one size fit all.
Yeah.
Right?
All
It
right.
all depends on you. If
Okay.
you're somebody who like indoors, you like
Or
a
like
quiet
nature.
room, that's fine. If you like nature, you can meditate while you're outdoors,
Okay.
right? You can meditate being still, you can meditate moving, right?
Okay.
So if you're moving. So one of those, for example, with moving, because when I say moving, sometimes persons say, but how do I meditate
And we
moving?
did talk, okay,
right?
yes,
So there's
yes.
a type of meditation that we teach as well that's called walking meditation.
Oh, wow.
Walking meditation.
Tell us more, Doc.
All right. So when we talk about that walking meditation, of course, we don't want you to be walking on a highway or,
Right.
where it's too busy, right?
No
so let's say you
way.
have a nice
Yeah.
backyard, right? A little backyard where you have space where you could walk,
Yeah.
right? So it's just basically you're walking, or the aim is not to go anywhere though, right? So you're literally not going anywhere. So this is going to be super slow, right? So you
Right.
slow it down a bit and you're just basically feeling the sensation of your limbs.
Yes.
And as you go, you just relax. You're just allowing the body to
Body to
relax
relax.
as you go on.
Okay.
Now, while you're in the backyard, let's say you saw a beautiful flower or butterfly,
Okay.
then you could switch to looking meditation, right? So you switch to looking meditation and you observe, because remember we said it's just bringing that awareness and
Okay.
being there in the moment.
Yes.
So you just basically switch to looking. If you heard a bird humming or something like that, then you switch to listening meditation. So it's just basically being there. So nature, being there with nature and, reflecting.
I must say,
All
you're
right?
speaking there, and I thought of
Re-
Adam and Eve in the garden.
But wasn't that what Adam and Eve was
Yes,
doing all day
yes,
long?
yes. I remember as a little
isn't that
child,
our
I had
purpose?
this picture. Yes.
Isn't that our purpose?
Yes. I had this picture with Adam and Eve, and the butterfly came on Eve's hand. No, for real. So it just drew me to, and no, those were the peaceful
But this
things.
sounds like paradise.
That was paradise. That was paradise.
Yes.
You don't have to be frustrated, no stress. It's paradise.
And that's what's the beautiful part about it, Zayniah. You could do it right anywhere you are. So
Yes.
you don't need to be any specific place.
Yes, you don't have to go to
right?
Hawaii
You don't have to
or Bora Bora.
exactly right here, right here, and right now. You can start. You can start your
wonderful,
journey. Yes.
wonderful. So once
Yes.
you have a backyard or anything that
Yes.
nature, if you're a nature lover,
If you're a nature lover,
anything.
yeah.
Wow, I really like that, and I think it's just bringing us to be more aware and to appreciate even our surroundings and the things that we have. The
Yes.
beautiful surroundings. Sometimes you could be living next to a river or a pond, and you could just sit and just relax
Yes.
and just, because sometimes it could be for maybe 20 minutes, 15 minutes, but it's just spending that time to release,
That's
you know,
it.
and just allowing yourself to just enjoy the moment and to
That's
just
it.
breathe
Yeah.
in. I love the fact that you mentioned of the breathing exercise, because I feel it can be incorporated at that time as well,
Yes,
you know,
yes.
and even as you read the word or whatever, you meditate on it. I just think that is just an amazing
Yes.
experience.
Yes.
And I think sometimes we're so busy that we don't take that time out for ourselves, and it really helps with our mental health as well. So I
Yes,
really love
yes.
that. I really love that. Okay, so we talked about the different types of meditation, and we looked at the benefits of meditation. All right, we also talked about how we can incorporate both meditation and fasting. Is there anything else you would also like to that you would share with your patients and viewers as to other things that you do or practice along with it? Especially those with those different conditions, those chronic conditions.
Okay. So, as you mentioned, the merge of the meditation and the fasting. So we actually have a pillar, right, where we
okay.
merge both the meditation and the fasting, and actually for weight loss,
Okay,
right? So for me to get into it, I have to talk a little bit about that type of meditation,
all right.
right? So that type of meditation now is called mindful eating.
Okay.
All right,
wow.
so you could say mindful eating or eating meditation.
Okay.
Okay, so what it's basically is, it's just you're eating, but you're aware of what you're eating.
Okay.
All
yeah.
right. So if whenever we have a plate of food, what's the first thing we do? We would pray, right?
Right.
So
We
we
pray, we
pray,
bless the
right? So you
meal.
bless the meal, you ponder on where this meal
Yeah.
come from.
Yeah.
A lot of the times now we talk a lot about organic. So if this is
Yes.
organic stuff that's
Yes.
going into nourishing your body.
Yes.
So you start from that place of gratitude,
Wonderful.
right? That place of
Wow.
gratitude. Now you're not just going to take the spoon and put the food in your mouth, right?
Okay.
So now you're going to observe the food. So
Yeah.
you're slowing it down a lot, right? So you observe the food, you observe the texture of the food, the color of the food, the shape of the food. Doesn't this remind you of when we were children?
Somewhat.
Doesn't this remind you of when we were kids? Right?
Well, yeah, you're paying attention to what you're
everything, right?
Yeah.
And then guess what? Then you take the food now, you put the food, right? You take in the aromas, everything,
Okay.
and you gradually put that food in your mouth. But when you put the food in your mouth, you're not going to just start to chew.
Okay.
Right? You allow the food to be in your mouth for some while, and you allow the flavors, the experience of flavors, and
Interesting.
even the texture again of that food.
Okay.
Then, right? Then you take your first bite, but you're conscious of all of this.
Okay.
Right? Then you take your first bite and you start to chew, and you start to you savor it again. Again, you savor it.
Yeah.
Then even at the point when you're going to swallow, you're aware of when you're going to swallow, and then you swallow. But
Okay.
even after you've swallowed, you're not going to just eat again. You're going to savor the aftertaste. And I'm
Wow.
telling you, if anyone have done this before, it's like a different experience. It almost feels like a sort of climax in the
Wow.
mouth. You get what I'm saying? So it's a really different experience.
Interesting,
And
Dr.
with
Jones.
time, what you're doing now,
Yeah.
of course, it wouldn't be as slow as I'm saying it,
Yeah,
right?
yeah,
But with
yeah.
time, it just means that you're going to develop a really healthy relationship
Yes.
with food,
Yes.
right? And you're
Yes.
conscious and you're aware.
right.
And that is what we're merging.
Yes.
We merge with the intermittent fasting as well, because we
Right.
don't want you to just be fasting,
And need
but
to
you're
eat.
right.
Yes.
So you're fasting, but you're fasting absent-mindedly.
Right.
And then when you
Yes.
break the fast, you eat, because
Yes.
some certain things that persons would say,
Yeah.
if you're fasting, they may say, but you have an eating disorder. And
Right.
fasting is actually one of the best ways to help with eating disorder,
eliminate
because
eating
and
disorders.
eliminate it,
That's
because you actually break that compulsiveness. You know how a lot of the time we always in
That
Grenada we say we
compulsion.
peck,
Yes.
and usually at
Just
night
yam
we
something, ain't
always
it?
peck. And the thing is, we're not hungry.
Yeah.
The word peck does not mean we're hungry.
No,
eh?
it's just that
We
you want a little
feel for
sugar.
something.
Your glucose. The body's saying, I just need a little glucose.
Right. So that is
yeah,
where
a
that
little sugar.
mindfulness. So
Yeah.
whatever you're doing, you're aware
That's
of what
right.
it is that
That's
you're not
very-
absent-mindedly doing stuff.
That's
you
very
know?
interesting, because what I've
Yes.
also learned is that we overeat and we eat blindly.
We eat blindly.
Back in the
We
day,
eat blindly.
you get a plate of food and you're watching the food, you're watching your sibling
remember
food,
that?
and it's
Do you
like
remember
he
that?
get more meat
Yes,
than me,
Zayniah,
he
that
get
is
more
it.
rice than me,
That
or
is
he
it,
get more this,
Zayniah.
and it's a competition that we
Yes.
have to have more food in the plate
Yes.
than your siblings. So
Right.
we grow up with that attitude,
Right.
not knowing we were actually eating
We
blindly.
right.
We weren't
Mindful
mindful.
then,
So it's like,
right.
and if you it's a competition too, who can eat faster than the other?
Okay.
So we're not paying attention as to what we're
Right.
eating. We're not enjoying the moment.
Right.
We're just yamming.
Yes,
It's like,
yes,
oh God,
I
never
get
finish.
you.
You're choking.
I get you. I
know,
get you.
This is how it used
I
to
get
be
you.
honest. This is how we were
Right.
trained. No
Yes.
one, I mean, now as we're physicians, you learn that we also have to take our time and chew and all of that. Oh, no, we grew up eating in that way.
Right.
We also grew up with that mentality that men should have a big plate of food. Now look at what we're having. We're having fathers and brothers and so many people with diabetes type 2. He have to have a big plate of food. Who told us that?
So
No.
all of it, I think, as you're saying, is like cultural. So
it's a lot of
cultural,
culture.
and may I just add that all of this, what I'm talking about, with all this intermittent fasting, it's something that is just taking a while to get
Yeah.
into our countries, but it's actually
Yeah.
been trending in the West
Yes.
for a long time. So
Yes.
among like celebrities, and so
Yes.
they have been using all this mindful eating and this
That's right.
intermittent fasting. But again, I think it's our culture
Yes.
that's actually preventing it from, a lot
Yes.
of the beliefs and
Yes.
myths
Yes.
that we have
Yeah.
that's preventing it from breaking into
That's
our,
true.
our society.
That's true. Because I remember little, Nuris. I remember little wondering about it. I saw my grandmother. She would prepare a bowl of. This man had his chew beef and pork in a bowl,
Right.
separate.
Right.
He had his rice. My grandfather had his rice in a bowl separate. So I remember little seeing my grandmother preparing this table. So I was there. So I went to the table too. Assuming that, it was lunch for everybody. Nuris, I kid you not. It was not lunch for everybody.
So it was just for your
his
grandfather.
meal. And he had a jug. She had a big mug of juice prepared for him. I was so confused. Right? And listen, this thing
You're
has
really
stayed
cracking me up
in
in the
my
corner here.
mind for years. I would never forget it. And I always remember, I know, yes, he worked hard. back in the day, a lot of our grandparents, had lands and the cocoa, and they had these different things that they will go and prepare and stuff like that. But the amount of food that they would eat, yes, but it's a traditional thing.
It's traditional.
It was a traditional
so it's
thing.
something traditional.
Yes. And now we have our vehicles. Now we exercise less. We actually are living more sedentary lifestyles. Many people.
Yes.
So then we have to look into it,
Yes.
and we have to be able to decrease our meal size, because sometimes we don't need that calorie intake.
That is it.
It's actually not
So
necessary.
then the body is just going to store it.
That's
because
right.
we're eating now in excess
That's
of
right.
what we're doing. So the body
Yes.
is now going to store. So
Yes.
you're not burning fat.
Not at
you're
all.
not burning fat. You're just storing. So then all
Yes.
the good benefits that we talked about when you're going to the ketosis, and
Yes.
you're not getting
any.
of those.
Okay, so these are the
Yeah.
things that would definitely contribute
Yes.
to the lifestyle diseases,
Yeah.
the chronic conditions like diabetes and the coronary artery diseases and so on.
Yes.
So I'm really happy that you can also you're here today to also add more to what healthcare is, and it's not just going, we go to our physicians and yes, we want but I'm happy that you can give us more knowledge, that we can also do other things to give that holistic being,
Yes.
to create a holistic being that is well-being, not just
and that point that you're saying well-being, right? Because that is what we're looking for, well-being. So it's not just absent of illness, because
Okay.
we're sitting here,
Yeah.
we don't think we have any illness because we're not
Right.
diagnosed, right? But at the same time, even if you're not diagnosed with something, you still want that well-being. So we're
Wonderful.
talking about
That's
even that
correct.
positive mindfulness. So it's
Yes.
more of this, more
Yes.
of that. So
Yes.
more of the good thing, more of the
Yes.
positivity,
Yes.
right?
Yes.
Yeah.
And guys, I'm just so grateful again that we have Dr. Jones with us today. Okay, so Selector Sabi says, what about drinking soup?
During the
Drinking
fast?
soup.
During
Is
the
it
fast?
during the fast?
Yes, so you can do soup as well, right? So you could do soup, so probably some sort of puree. Some persons, they do like broth, like those like fish broth and so. So you can, because as long as you're not eating, so you could do soups as well. That's actually a good
He
option.
brought a good point here, because we did discuss about the taboo. Sometimes people would say, "Oh my God, if I don't eat as pertaining to
Yes.
fasting, I'm going to get gas." Tell us
Yes.
about that, though. What has
Yes.
research shown?
Yes, so a lot of the times all this gas and this bloating, right, is as a result of us constantly engaging with food.
Okay, so
all
actually the
right?
opposite.
The opposite. So it's
Okay.
like now you're having more water reabsorption. All right, and this is research that I've looked
That's
at.
correct.
All right, so long term now, if you switch it now and you actually fasting,
Yes.
it means that you get rid of gas.
Wow.
So if you want to get rid of gas, you actually do a dry fast. Let's say you dry fast for today. Like let's say you didn't eat anything today. You're going to break fast later, right? But
Yeah.
you didn't eat anything today. And dry fast means you didn't eat or drink. You get rid of all that gas.
Wonderful.
All that gas and that
Okay.
bloating. Yeah,
Okay,
you
'cause
get
all
rid
of
of
that
it.
water would then
all
be
that
flushed
water will
out.
be
Okay,
yes.
wonderful.
Yes.
Wonderful. So again, guys, I'm so happy that we have Dr. Jones with us today, because again, our next episode, we really want to get into diabetes and especially type 2 diabetes,
Lovely.
as it is a chronic plague, I call it,
Yes.
So I really want us to learn a lot from these different
Techniques
I would say
and-
techniques
yes.
and these different other ways in which we can focus on our health. So again, guys, first of all, I'd just like to thank you, Dr. Jones. Thank you so much for your expertise. Thank you for your knowledge. And I want to thank all our viewers, all our listeners for joining us this evening on Heavenly Medicine. I also would like to thank DJ Sabi for being with us. He's in the background. He's helping us. He knows we ladies, I'm so grateful. Again, guys, thank you so much. I really hope that this would have added so much knowledge to you and also would help you. We are in the Christmas season, and I don't want to bust any bubbles, out there, but I know that one thing that I'm very convicted about is in terms of the chronic diseases, especially the diabetes type 2, and I really want us to get into that. And in our next episode, the title we're looking at is Have You Been Naughty or Nice? And guys, I want you to be able to call in. I want you to share your experiences as to what you are doing to help the family in preventing these type of conditions. And even if you have members in your family that may have this disease or condition, what is it that the family is doing as a whole to not keep this person away from enjoying the Christmas season, but also to be a part? So what is the family doing to incorporate good lifestyle, healthy choices, and so on, among, with all the celebration and with all the festivities? I would like you guys to call in and let us know, because we're waiting on those calls, whether you've been naughty or nice. How have you been treating that beautiful heavenly body that God has given you? Okay, guys, so again, we'd like to thank you. Have a good night. Be blessed. Stay safe. Drive safe, guys. Those of you that's also listening to us on the road, be safe. Blessings to you. And remember, your health is your wealth. Till we meet again. Bye for now. Take care.
You didn't come for the strong, you're here for the broken. This is my song of intercession, God. Only you know. Only you know how it feels inside. This pain when you try to hide it. Afraid to cry for help, you smile and drown it out. Only you know how it feels inside to try and try and try and try and try and fail. Only you know why you say the clock and he's not home. Out with his boys drinking, 'cause he knows when he goes home and opens that door, it's another night of fighting or silence. She's cutting up deep, and they just think that she's crazy, but you know better, doctor. You know she's being touched in the wrong way. Oh, doctor, can you heal him? I pray, 'cause if you don't,